I'd like to introduce Barb from the United States, who has RSD. Welcome, Barb.
Hello there.
Could you tell us what RSD is, please?
It stands for Reflex Sympathetic Dystrophy. And that means that the sympathetic nervous system was affected from a traumatic event that happened to my body. And it kind of shut down the sympathetic nervous system. In lay terms, that's the best way to put it.
Mm-hmm.
I had an elective surgery on one foot, a bunionectomy, in 2003. And after the surgery, I was taking like a half a Vicodin, which normally would put me to sleep for 6 hours for any discomfort. I was putting ice on my foot, but within 3 days, I had severe pain, burning, purple toes. I thought the dressing was too tight, took down the dressing, still had throbbing of my foot any time, whether I was standing or lying. And it turned out that my body read what was going on as severe pain that was not relieved by anything. Ice made it worse. So we went along for a while, and then all of a sudden my right foot, the left foot was the one operated on, the right foot became painful. My orthopedic doctor said, well, because you're hobbling around on crutches using just your right foot, which also has a painful bunion in it, just put ice to that foot. Long story short, both feet developed the severe pain, burning, numbness, purple color. And I'm a surgical nurse, so I figured out something's not right here. My right foot had no surgery done. So I ended up going to a cardiovascular surgeon who diagnosed it as reflex sympathetic dystrophy. Good news was they knew what it was. Bad news was they didn't know how to treat it. And so he said, just stay on the internet, Barb, and eventually you'll find a way that they're finding a way to treat it. Fast forward 4 years, I went to 8 neurologists, 5 anesthesiologists, many sympathetic nerve blocks, miserable life of pain. I was suicidal twice. I went to a RSD conference in Portland, Maine, and I live in San Diego. Went to a conference, saw 170 people with RSD. It's also called chronic regional pain syndrome, or CRPS is another term for it. And these people in wheelchairs, walkers, braces, very crippling diseases going on. I found out that RSD could affect any part of the body after anything, an abdominal surgery, a stubbed toe. Very weird at what I was learning. Anyway, I stayed on the internet and I started finding out that they were doing ketamine infusions called coma techniques in Germany. Then my research led me to find Dr. Harbut and Correll in Australia, who were doing low dose infusion ketamine drug to patients that had severe pain. They didn't know why it wouldn't turn around. And long story short, I found a neurologist in San Diego, in La Jolla. Her name is Dr. Nancy Sabin. Her website is painsandiego.com, and my case study is on that also. She was using some oral ketamine, and I was determined to find someone to give me ketamine. And eventually I was determined to have that ketamine infusion. So long story short, I did go to Drexel University in Philadelphia for ketamine infusion in May of 2007. My pain completely went away. I had, by the way, been on Low Dose Naltrexone since Dr. Sabin first saw me in 2006. She had me on a microscopic dose of, it was like 1 to 4 micrograms. And I was taking it the whole time. She had me on OxyContin and methadone, and then we switched to something else. And we didn't attribute anything that was going on in my body at that time to the naltrexone. But after I did the ketamine infusion, she kept me on the low-dose naltrexone. She had seen a lot of her patients have their pain go away from being on small doses of naltrexone. So she believed in me being always on it also. As it turned out, I had euphoria, side effects of the ketamine. I had to have some ketamine boosters when I was back here in San Diego. I was treated with Lamictal because I seemed to have symptoms of like bipolar disorder, but it was really the side effects from the ketamine. And we eventually weaned me off the Lamictal. Some of my buzzing came back in my feet, and so she adjusted the medications that I was on, but I basically got weaned off of all the other drugs, and the only thing I stayed on was Low Dose Naltrexone, and the pain has stayed gone. I have occasional buzzing, but I take 12.5 milligrams a day, and I'm a happy camper. I'm working back in surgery now. I work about 30 hours a month because I don't want to overdo it on my feet. I do not ever want the RSD to come back, and that's my story. I'm sticking to it.
That is some story, isn't it? I'm really amazed. So what have you done to help these other people with RSD? Have you managed to let other people know?
I refer them to my Dr. Sullivan's website, and I tell them to look up my case study because that, in a nutshell, gives them the whole ramifications of what I went through, how I developed RSD. I was debilitated. I was in a wheelchair for a while. I was suicidal. I had severe pain. On the McGill Pain Index, RSD is the highest kind of pain a human body can endure. It's not a pleasant thing. Most RSD patients end up in some pain management doctor's office or an anesthesiologist, and they get back pain stimulators put in them, which is kind of crazy. I mean, it's a way to treat it. They thread these little electrodes up the back, and these electrodes are hooked into like a little pacemaker battery box that's implanted in their waist area, and they set the current to go up and buzz the nerves to change the messages of the pain. Well, most of those fail. They might help them for a couple months, 6 months to a year. They get all kinds of problems with fractured lead wires, infected pockets where the battery is. Very few patients are very successful with back pain stimulators. And I'll be very frank about that because my doctor at Drexel University, Dr. Robert Schwartzman, is the one that does the low-dose ketamine infusions. He has seen a lot of patients with RSD do well at first with the ketamine, but then they kind of maybe have it come back. It depends on the stage of the RSD, of when they've been treated with the ketamine, as far as how successful they are. Mm-hmm. He also sends patients down to Monterrey, Mexico. He has doctors down in Tampa, Florida, that see the RSD patients, and then they ship them down to a hospital in Monterrey. It's about a $50,000 procedure, and it's not covered by insurance down there. Mine was covered by my Medicare and Blue Cross Blue Shield in Pennsylvania. My boosters were covered out here in San Diego by me getting the correct billing codes from Philadelphia and sharing them with Dr. Wales here in San Diego. He's with Pacific Pain Medicine. So there's quite a few patients still able to get the ketamine infusion, and they do have success with that. But from everything that I know and I share, is that the combination of what I take is now only the naltrexone. And I did cut it back for a while. I was taking 12.5 milligrams every other day. Oh, and by the way, I'm saying 12.5 milligrams because it's cheaper for me out of pocket to get, my insurance covers the 50 milligram tablets. Here in the United States, if you're going to get it in a different dosage, a lot of the patients have to get it through a compounding pharmacist. And some of the medical insurance does not cover the compounded drug, which mine didn't a couple years ago. So we decided I'd just take that 50 milligram tablet and cut it in fourths, and I took the 12.5 milligrams every other day. And so for about a year, I was doing just fine that way. I did start having a little more buzzing happen, and so my doctor and I decided, let's just take it to 12.5 milligrams every day. And that's what I do. And the only side effect I've ever noticed is that I sometimes had insomnia, so I switched from taking it in the evening to taking it in the morning. I do periodically add temazepam, which is a sleep medication, just to make sure that I get a good solid 8 hours of sleep. Another side effect, possibly, is that I am a busier person. I have lots of activity that I can do. I hike mountains, I go water skiing, I do everything that I used to do in life, but I have lots of energy. And that might be a side effect from the naltrexone. I don't know. But I'm 62 years old. I'm a very healthy 62 years old, and I'm proud of that. I use a bicycle a lot. I hike a lot. I travel a lot. My husband's retired from medical sales, and we go to Cancun once or twice a year. We go to Park City, Utah, and go biking down the mountains. So we have a very active lifestyle, and he's very pleased that my pain is gone.
I bet.
Yeah, pain in a relationship, a patient with chronic pain, is not a pretty picture. Mm-hmm. It's very hard for the family, and they really need a support system to help them. Frankly, when I went to Dr. Sabin, she insists all of her pain patients go to a pain psychologist. So here's another name. Dr. Thomas Gibson is an excellent pain psychologist here in La Jolla. And my husband went to him also because there were many ramifications with a chronic pain patient being a difficult person to live with. Mm-hmm. That's in a short sentence how to put how life was with Barb. Anyway, my last 3 years or so, I have referred quite a few patients to Dr. Sabin. That's on her website also. She did send me an email this morning I should share because she knew I was going to be doing this interview with you, and she said, be sure to let her know that for pain patients, the timing of dosing the LDN does not matter. Let her know that the new receptor found in 2008 and all of the info on glia and the immune system on my website, the top left article in the skinny column, she said no doubt she knows that the glia are the hallmark of pathology in MS, multiple sclerosis. So my pain doctor is a very, very ambitious neurologist. She's done research at many places in her past and has really devoted her life to pain patients. And she has worked with this low-dose naltrexone for quite a few years. She's been going to the conferences that we have here in the United States, and I think she's probably helping a lot of patients to see that this medication does do a lot for many.